On this edition of Veterans Health Watch, we're talking about chronic obstructive pulmonary disease, or COPD, and we'll learn about what the VA Maryland healthcare system is doing to help veterans manage it, including helping veterans quit smoking. So please join us. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. Breathing is something we all do every day without much thought, but for those with chronic obstructive pulmonary disease, breathing can be hard to do. Joining us today to help us understand COPD is Dr. Robert Reed, a pulmonologist with the VA Maryland healthcare system. Thank you so much for joining us, Dr. Reed.
Hi, Kenya. Thanks for having me.
So let's start with a definition or an explanation of COPD. What is it?
So COPD is a term that we use to describe a number of conditions that all result in obstruction of the airflow out of the lung. When we talk about emphysema or chronic bronchitis, those are types of COPD. Emphysema is a type of COPD that is primarily characterized by being short of breath, whereas chronic bronchitis is a type of COPD that is more associated with a chronic cough productive of a lot of phlegm. And it's certainly possible to have both of those conditions and the symptoms that they suffer from concomitantly, and that's why we have kind of gone to the term COPD. It's also important to realize that asthma is overlapping with this condition as well, and in itself can progress on to be one of the forms of COPD, and there can be an asthma-COPD overlap.
Well, I'm glad we're talking about this, and I've seen commercials for different treatments for COPD, so how common is it?
COPD is quite common. It's one of the most common conditions that people suffer from in the United States. Over 15 million people have COPD, and that's likely a dramatic underestimate. There are probably another 15 million Americans who have not been diagnosed with COPD but have it.
So for something so common, do we know the cause of it?
The cause of COPD is pretty clear. It is primarily caused by breathing things in that you shouldn't. And the thing that most people breathe in that they shouldn't is tobacco smoke. There are some people who develop COPD without an exposure to tobacco. Environmental dust particles can contribute to the condition. There's also a clear need for susceptibility. Everybody knows somebody who has smoked their whole life and they haven't developed COPD, and some people just don't have the genetic susceptibility to it. So it requires a susceptibility as well as an exposure to something that then damages the lung, and that causes COPD.
And of course, we treat veterans at the VA, and I've learned that veterans are more likely to have COPD, or are they more likely to have COPD, and why?
We have a lot of veterans with COPD, and I think that a lot of the issue associated with that is the frequency of smoking in our veteran population. Mm-hmm. I've spoken to veterans in the past who explained to me that smoking was one of the conditions that the VA helped them to kick, but the military was also responsible for. I had a veteran tell me that he had two options in Vietnam. He could either take a smoking break with his squad or do bare knuckle push-ups, and it was an easy decision for him. Yeah. So he was glad to be able to kick the habit through the VA with us.
And later we'll talk about how the VA is helping our veterans kick that habit. Mm-hmm. For now, treatment for COPD, I know there's no cure for it, but what are the treatment options?
There is no cure for COPD, that's right. There are a number of treatments that can be pretty effective at treating the symptoms. There are a number of inhalers that can open up the lungs a bit and allow the breathing to be more easy. We also have treatments intended to reduce exacerbations. Exacerbations are periods where the symptoms are worse and require more treatments like steroids or antibiotics, and they are definitely a major problem in the lives of folks that suffer from COPD. The primary treatment for COPD is smoking cessation. That is really the most important thing that we can do in order to both prevent the development of COPD as well as to reduce the ongoing destruction caused by the smoking that leads to progression of COPD. If people can stop smoking, they can actually slow down the rate of the lung function decline and reduce the chance that COPD will become a crippling condition if they were to continue to smoke.
And so for those people who have COPD, how could they manage it? You mentioned the medications. What other steps can someone take to manage this disease?
Well, I think that it's important to realize that COPD as a smoking-related illness is going to be associated with a lot of other conditions like heart disease, like cancer, and those are in many ways much more treatable than COPD. And so recognizing these comorbid conditions that we have good treatments for is important. Specific to the COPD, stopping smoking is important. If people need oxygen, then that can be of use to them. We have a number of therapies that are not effective in smokers, but once they have stopped smoking, become options, including ambulatory ventilators for folks who really suffer from very limiting shortness of breath. There are a number of surgical options. If people have just the right type of lung, there's a surgery called a lung volume reduction that can be effective at improving quality of life in people that have just the right type of lung for it. And then at the end, lung transplant is an option that we sometimes exercise in order to help our folks with COPD who have come to the end of the road do better and live longer.
And for this show, one of our goals is to encourage veterans to get the treatment, to inform them about all the services that are available, and then to encourage them to come in and take advantage of those services. And sometimes that can be a challenge. People want to ignore symptoms, or they want to kind of rationalize them as something else. So can you explain what could happen if COPD goes untreated?
If COPD goes untreated, it is a chronic progressive disease. It's not likely that folks are going to experience some healing and improve. It's most likely to go on to result in more and more shortness of breath over time, particularly if they fall into more of that emphysematous type of person. If there's someone who's prone to develop exacerbations, then having an exacerbation makes it more likely that you'll have one in the future. And if we fail to aggressively treat and prevent exacerbations, it's more likely that that's going to continue to be a bigger problem, and it can lead to hospitalizations, it can lead to deconditioning, and that's a really bad spiral for our folks with COPD. Once their breathing limits them to the point where they become deconditioned, then the body is weaker and they do less, and that's really a spiral that ultimately leads to a pretty profound deterioration and oftentimes death. It's really important, I think, to emphasize that exercise is something that folks with COPD can do, even though it's hard. There are ways that our vets can exercise who have COPD, and there are ways to encourage them and teach them how to breathe and calm themselves down as they're breathing more rapidly. One of the problems with COPD is that when you can't breathe, it makes you very anxious, and dealing with that anxiety is a central and important role of the treatments that we provide.
I was going to ask about that. For the things that you mentioned, do you work with the veterans and teach them? I'm sure you teach them how to breathe and all the techniques you talked about.
We do. We spend some time on that, and we are in the process of starting up a pulmonary rehabilitation for our veterans with COPD that should start imminently, and that'll be a central part of the education that they receive in that context.
And so just to remind our veterans again about the symptoms, you touched on it a little bit, but what symptoms would a veteran experience if they have COPD in whatever form, and what should they do?
Well, the symptoms that most people are going to experience when they have COPD are going to be that they get easily winded. When they do what they used to take for granted, they're finding that they have to stop and take breaks. They also might find that they have a chronic productive cough and it just doesn't seem to go away. If they catch a cold, it'll linger for not just weeks but months. And if they have any of these symptoms, then they should notify their doctor. And it's a pretty easy diagnosis to make with a set of pulmonary function tests. We might take a chest X-ray or a CT scan in order to look at the lungs directly. And if they're still smoking, if they can stop that, that's going to be good for the lungs, but even better for the heart and even better for their risk of developing cancer in the future.
Great. Well, thank you so much for joining us. We're going to take a short break, but when we return, we'll learn more about COPD. So please stay tuned.
I think one of the exciting campaigns that the VA Maryland healthcare system has embarked on is the TeleVet campaign. As a veteran myself, I'm really more interested in what a fellow veteran's perspective on their healthcare service is going to be. So I would really encourage all of our veterans who have been to a VA Maryland healthcare facility to tell fellow veterans about their experience.
I wish someone would have told me about the VA healthcare years ago. If you see a veteran, ask them if they're using VA healthcare.
Make a difference. Tell a vet.
Welcome back to Veterans Health Watch. We've been talking with Dr. Robert Reed about COPD. Dr. Reed, thank you for joining us again. Let's recap some of the conditions you mentioned that fall under the umbrella of COPD.
Sure. The two primary forms of COPD include emphysema and chronic bronchitis. In the medical jargon, we talk about emphysema in the terms of the pink puffer, and this is someone who is thin. There is an association with cachexia, although that's not a hard and fast rule.
Could you explain cachexia?
Cachexia is weight loss. So these are often people who, no matter how much they eat, they just can't gain weight. And sometimes that's because their bodies are hypermetabolic. They're requiring a lot of calories. The other reason is because they just can't eat that much. Your stomach sits right next to the big muscle that helps you breathe, and when you fill your stomach, it actually makes it a little bit more difficult to breathe for these folks, and so it's a challenge for them. The other type of COPD, the chronic bronchitis, is referred to as the blue bloater, and that's somebody who's producing a lot of phlegm. They're more often in the spectrum of having oxygen problems, and that's the blue because their oxygen is low and they turn a little bit blue when they're low. That's an old way of thinking of COPD, and it's sort of the two extremes. And what we see is that people more often than not have a combination of both. They both have some degree of this emphysema as well as the chronic cough and phlegm.
And you touched on the pulmonary rehab and some of the medications. Tell us more about what's involved with pulmonary rehab.
Pulmonary rehab is intended to break the spiral of feeling short of breath and then doing less because you're short of breath and then becoming deconditioned, and that eventually leads to a spiraling down to the point where folks are very limited.
Could you talk about deconditioning a little more? Explain that. What do you mean by deconditioning?
Just getting out of shape.
Okay.
If you don't exercise because you can't because of your lungs, then your muscles atrophy and you get weaker.
Okay.
And pulmonary rehabilitation is intended to break that spiral. It combines both exercise with education, and there are ways that people with COPD can exercise. They can lift weights. What most folks with COPD experience is that when they breathe a little bit faster, they're able to breathe in rather quickly, but they take a long time to breathe out. And so if they breathe at a fast rate, each breath leaves their lung more and more full, and they feel like they're they're going to pop. Their chest gets very full and it's uncomfortable, and they have to stop. They hit a wall where they just got to stop and catch their breath. And so as a part of pulmonary rehabilitation, the education component, one of the components of education is to teach them ways to control their breathing, ways to control their anxiety, to breathe slowly, and to exercise in intervals. They can exercise fairly hard and then stop and take a break, exercise fairly hard and then stop and take a break.
Mm-hmm. And what about lifestyle changes that people can implement when either they have been diagnosed with COPD or as part of a prevention?
I think that the big aspect of lifestyle is smoking cessation, and maintaining a healthy diet is important as well, and maintaining exercise is important. The diet's interesting. The diet has been a challenge to show that it's of dramatic benefit in many conditions. In COPD, we know that the vitamin C requirements are higher than they would be in a patient or a person who does not have COPD. And because of that increased requirement for vitamin C, I've actually seen a number of patients with COPD who have overt scurvy. They have a vitamin C deficiency that is probably more well known amongst pirates of the Caribbean.
So you recommend, as far as a lifestyle change in the vitamin C, what do you recommend to your patients?
I recommend to them that they need to eat a lot of fresh fruits and vegetables, which I recommend to everyone.
Yeah.
But it's of particular importance with folks with COPD. And if it's a struggle for them to get out and get fresh fruits and vegetables, we try to find ways to make it work for them.
Well, I know we definitely want our veterans to get the point, come in, get the treatment. There's education and help available for those who have COPD. Mm-hmm. Is there anything else we're going to take another break. Is there anything else you would like to leave for our patients or for our veterans about COPD and maintaining a good, healthy lifestyle?
I think it's important to realize that even though they feel somewhat limited by the lungs, it really is a use it or lose it scenario. They need to push through and continue to exercise, and we can help them find ways to make that work.
Dr. Reed, before we go to our last break, are there any seasonal tips for people living with COPD that you can give?
You bet. If we remember that COPD, a lot of folks actually also have asthma, and asthma can be associated with a lot of different triggers. Even aside from asthma, people with lung disease can be triggered to have more symptoms by a lot of different things. And people know themselves and they can identify those triggers, whether it's perfume, exposure to smoke, whether it's hot air and humid air on a summer day, cold air in the winter. Any of these things can set people off, and it's important to recognize what's bothering people. It's a little more subtle on days where the pollution levels are high, and that is associated with an increase in symptoms. And so for folks who are prone to be triggered by bad air, it's important to keep an eye on how bad the air is on a particular day when they're contemplating going out. It's also important in the wintertime to be sure that your vaccines are up to date, your flu shot and your pneumonia shot. Those are of considerable benefit for our folks with lung disease.
Absolutely. Great tips. Thank you. Thank you so much for joining us today, Dr. Reed.
It was my pleasure.
We'll take a short break, but when we return, we'll learn what veterans can do if they want to quit smoking. So please join us.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.
Welcome back to Veterans Health Watch. We've been talking about COPD and how smoking can impact the disease. If you are a veteran and you want to quit smoking, help is available through the VA Maryland healthcare system. And joining us to tell us more is Dr. Ann Brew, a psychologist with the VA Maryland healthcare system. Dr. Brew, thank you so much for joining us.
Thank you for having me.
So let's get started. Many of our veterans we know smoke. We learned earlier in the show that veterans are more prone to smoking, and we know many of them want to quit smoking. How can the VA help?
Well, the great news is that there are actually a lot of different ways that the VA can help. And we can help folks who are just starting to think about quitting smoking. We can also help folks who have been thinking about it for a long time and maybe have been really struggling with it. And we can also help folks who have gotten a medical diagnosis and need to quit, or need to quit because they have a procedure coming up. And we have a variety of options. We have individual counseling that's really tailored to the veteran's needs, and that's usually about 4 sessions where the veteran and the counselor work together to come up with a quit plan and then support the veteran as they put that plan into action. We also have group counseling where veterans can get support from a trained counselor, as well as from other veterans who are going through the same thing and who are also trying to quit, which can be pretty powerful.
Yeah.
We also have our national quit line, our VA national quit line, which is 1-855-QUIT-VET. And when veterans call that number, they get a health coach who walks them through the process of quitting. And then we have a text messaging program, which is our Smoke-Free Vet program, and that offers 24/7 advice and encouragement and support to help veterans quit. We have medications. We have the nicotine patch, the nicotine lozenge, and the nicotine gum, as well as bupropion and varenicline, which veterans may know as Zyban and Chantix. So we have a lot of different options, and veterans can sort of pick what will work best for them and what's going to work best with their schedule. The one thing that we do recommend, though, is that veterans choose at least one medication and at least one counseling or support option, because we know that veterans who are most likely to quit are the ones who use both counseling combined with some type of medication.
And it's amazing to think of how hard it is to quit smoking. We hear the stories of people who've been able to kick so many other habits, and smoking is so hard. So it's great to hear that we have these supportive services available to our veterans so they can reach out and get them. Where are these services located?
All of our VAMX locations offer some type, all of our VA Maryland locations offer some type of tobacco cessation service. And the best way for veterans to find out what's available at their clinic is to ask their primary care doctor. But we do offer 2 options that are available to all veterans regardless of their location, and that is our National VA Quit Line, the 1-855-QUIT-VET, and our text messaging program, Smoke-Free Vet.
And we learned, like I said in our earlier segment, we talked about COPD and the serious impact that smoking can have on that disease. Even for those in veterans, some people are still smoking even with the disease. Is it ever too late to stop smoking?
We would always recommend that veterans, and we would encourage them to come and get help and to think about quitting, to consider quitting, especially for folks with COPD, because as we heard, it can't be, there's no cure, but it can be managed. And one of the best ways to manage COPD is actually to quit smoking. And if folks with COPD can quit smoking, there are some very real benefits to that. It's less likely that they'll die from COPD or that they'll die from another disease. It's less likely that they'll have COPD flare-ups and their symptoms of COPD can be improved. Their lung function can also improve when they quit, and it can slow the progression of the loss of lung tissue, which are some pretty important benefits to a lot of folks.
Yeah, worth it. It's definitely worth a try. And we know that some people who have substance abuse issues have other mental health issues, and some people use smoking as a way to reduce stress. What would you say about that?
It's actually a common misconception that smoking can relieve stress. Any initial stress relief that is felt in the beginning is quickly replaced by the symptoms of nicotine withdrawal. So if folks are smoking cigarettes every day, they're going through withdrawal between each cigarette. And typically, and withdrawal can include things like irritability and anxiety. So we know that smoking can actually make mental health symptoms worse, but the flip side of that is that quitting can actually help improve mental health symptoms and can improve symptoms of depression and symptoms of PTSD. So we would encourage those folks to actually reach out to their mental health provider or reach out to us at the quit smoking or the quit tobacco programs so that we can help them develop strategies for managing stress that are healthier.
Especially like you said, when you stop, you're going to go through that initial withdrawal and you need somebody to help you get over the hump, so to speak, to know that it's temporary.
Yeah.
And what about and we know that some people see smoking as less harmful than drinking or a drug addiction. And as a clinician, I'm sure you've seen some of the results of smoking. What would you say about that and the comparison between smoking and the impact that it could have as opposed to drinking or some other harmful habits?
Yeah, I think it's important to realize that tobacco use comes with a lot of its own health concerns, especially for folks who are using tobacco along with other substances, for instance, alcohol. Those folks are actually at an increased risk for cancers of the mouth and cancers of the throat and cancers of the esophagus. And they're still at risk for conditions that everybody who smokes is at risk for, such as the COPD and heart disease and stroke.
And just from your perspective, could you tell us why you've seen some veterans struggle with quitting smoking? Why does it seem to be more difficult to quit smoking than some other bad habits?
Yeah.
What is it about smoking that seems so difficult to quit?
I think there's kind of two things that play a role. So one is habit. After smoking for a certain amount of time, your hand just kind of knows when to reach for that cigarette. So there's definitely a habit component. And then it is very physically addictive as well. And that's why we actually recommend doing both the counseling to help you change your habits and the medication to help with the physical symptoms of withdrawal.
Thank you for explaining that. That helps. And before we wrap up, could you tell us how a veteran can get started with getting the help that you mentioned?
There's actually numerous ways to get started. One way is to talk with your VA primary care provider, who can often prescribe medications and then let you know what services are available at that location. Veterans can also call 1-855-QUIT-VET. That's Monday through Friday, 9 a.m. to 9 p.m. to get their individual quit coach to help them quit. Veterans can also enroll in a Smoke-Free Vet text messaging program, and they can do that by texting the word VET, V-E-T, to the number 47848, and they can get started that way. Or they can come to our tobacco cessation group that we have here at Baltimore, which is Tuesdays at 10 a.m. on the 6th floor. So we have a number of different ways to get started, and we'd be happy to hear from veterans in whatever way they feel most comfortable reaching out to us.
Great, thank you. Before we wrap up, do you have any closing words you would like to give to veterans about those veterans who want to quit smoking and just can't seem to kick the habit?
I would say don't give up. The more you try, the more likely it is that you will succeed. And reach out to us, let us know, because the VA is here to help.
Great, thank you so much for joining us, Dr. Brew.
Thank you for having me.
Well, that wraps up this segment of Veterans Health Watch. If you have questions about today's topic or would like to make suggestions for future shows, please give us a call. You can also visit our website or follow us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please apply for our services. We look forward to serving you. Please join us next time.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I receive has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.